أستأذن سموكم للبدء. بسم الله الرحمن الرحيم. جلالة الملك عبد الله الثاني ملك المملكة الأردنية الهاشمية الشقيقة، صاحب السمو الشيخ محمد بن زايد آل نهيان ولي عهد أبوظبي نائب القائد الأعلى للقوات المسلحة، أصحاب السمو الشيوخ، أصحاب المعالي والسعادة، الضيوف الكرام، السلام عليكم ورحمة الله وبركاته. اسمحوا لي بداية بالتعريف عن نفسي. محدثكم عبد الله بن عبد العزيز الشامسي، رئيس مبادلة الرعاية الصحية، وحدة الأعمال التابعة لشركة مبادلة للاستثمار. ويشرفني اليوم أن أتولى مهمة إدارة هذا الحوار في هذا المجلس الكريم. والآن اسمحوا لي بأن أكمل حديثي باللغة الإنجليزية. Your Majesty, Your Highnesses, Excellencies, Ladies and Gentlemen. We are pleased to have with us today two global experts in the practice of children's medicine, Professor Bobby Gasper and Professor Manju Kurian of London's Great Ormond Street Hospital for Children. Professor Gasper has pioneered gene therapy research for the last 20 years and is the world-leading expert on immunodeficiencies. Professor Kurian is an expert in childhood movement disorders, including early onset dystonia and Parkinson's. As brief context to their coming remarks, you should know that Her Majesty, Her Highness Sheikha Fatima bint Mubarak, Mother of the Nation, has made a transformational gift to the Great Ormond Street Hospital for Children that will make possible this July the opening of the Zayed Center for Research into Rare Disease in Children. The center will offer state-of-the-art new laboratories and platform technologies where researchers, clinicians, can collaborate to develop groundbreaking new treatments for rare and complex diseases. It is expected that many of these next-generation treatments will draw on the pioneering work of our two guests this evening. Please join me in welcoming Professor Bobby Gasper and Manju Kurian. Professor.
Your Royal Highness, Your Excellencies, esteemed guests. It really is a deep honor, an enormous privilege for myself and Professor Manju Kurian to stand before you today to talk about the Zayed Center for Research into Rare Diseases in Children. We're only here because of your extraordinary gift and your generosity in building this center. The Zayed Center for Research will sit at the heart of a partnership between Great Ormond Street Hospital in London, one of the leading children's hospitals, and University College London, one of the top universities in the world. And as my esteemed colleague has said, what we are setting out to do is what it says on the slide here. We want to change the global face of children's medicine through research and clinical developments so we can give a better life for children suffering from severe, rare, and complex diseases. But first, let me just start by going back to the beginning. Great Ormond Street Hospital was set up as a unique hospital for children back in 1852. At that time, children was thought of as little adults, and we know they're not. Their diseases are different, they can be more complex, and we need to think about different treatments for children in comparison to adults. For any of you with children, you know that children are different to adults. The hospital was established by Dr. Charles West. He initially had just 10 beds in order to provide healthcare for children of the poor. He wanted to train pediatric nurses and to encourage clinical research in all of child health. And those values are still at the heart of what Great Ormond Street does today. But of course, as over the last 150 years or so, the hospital has grown enormously. As I said, it is one of the top children's hospitals in the world. And now Great Ormond Street today has over 300,000 patient visits per year for children with rare and complex disorders. And I'm talking about rare diseases because there are many great hospitals in the UK and in Europe and elsewhere that look after children with more common diseases. But sometimes when diseases are rare and difficult, they need to go to specialist centres so that children can have the appropriate care and the appropriate treatment. And that is what Great Ormond Street has become. The specialist doctors, the researchers, the nurses, the infrastructure around it is to look after children who have nowhere else to go. They come to Great Ormond Street because it's one of the few hospitals that can offer this kind of life-changing care and treatment. We have specialized services to cater for these diseases. We have 50 to 60 life-changing operations every day. And it is a research hospital. That means there is a partnership with UCL, University College London, where we look to try and understand what is the underlying cause of disease. And nowadays, it is what is the genetic cause of disease. We look to try and understand how that disease comes about, and we want to try and develop better treatments based on the new technologies of gene and cell therapy and personalized medicine to offer better, more personalized treatments for these children. And it's not just about a hospital in London on Great Ormond Street. It is a hospital that serves an international community. There are 138 international research collaborations. So we want to collaborate with the top hospitals and universities around the world because we know that that spirit of collaboration is important in making these happen. And we know personally, both of us, that we have to collaborate internationally in order to bring these medicines through to children in an appropriate time frame. There are research studies that are conducted with participants. There are clinical studies that are conducted around the globe as well. And rare diseases are not so rare. So, although it might sound paradoxical, rare disease, when you put them together, are actually not that rare. And here are just some figures. There are at least 6,000 rare diseases. 75% of them affect children. Many are genetic in nature. Approximately 80% have an underlying genetic origin. So that means that there is a gene that is either defective or missing or not working that leads to this disease. About 1 in 17 people will suffer from a rare disease at some point in their lives. So again, it illustrates that they really are not so rare. And importantly, 30% of rare disease patients will die before their 5th birthday. And so that is the burden of illness that we are looking after. And that is why it's so important to have a center that is dedicated and uniquely dedicated to looking after these children with such a high burden of disease and very few therapeutic opportunities. Medicine is changing. We used to think of medicine like this. We used to think of pills and potions and infusions. But what we want to do is we want to use your genetic material, use the underlying fundamental basis of disease, the gene or the cell, to now correct these rare diseases. And these are the technologies that will shape the medicines of the future. And at the ZCR, in conjunction with our collaborators, we want to be at the forefront of bringing these gene and cell therapies to children around the world. And this is just as a small lesson, inside every cell, we have a nucleus. Inside that nucleus, there are 23 pairs of chromosomes. And on those 23 pairs of chromosomes are approximately 25,000 genes. Genes that control everything that we are, from how tall we are, the color of our hair, and many, many other attributes. And sometimes when a gene goes wrong, when an important gene goes wrong, then it can cause a very severe disease. Just one single gene, one single mistake can cause a devastating disease. And now we have the technology and the ability to identify the gene that is missing in a particular disease. And if we can understand what that gene is, if we can understand why it caused the disease, then maybe we can use that information to try and correct and repair the disease. And I'm going to show you examples of how we've been able to do that ourselves over the years through research. And I'm going to illustrate that in just 3 stories. So this is a little girl that I looked after, and she came to me in May 2013, so 6 years ago now. And this is what she looked like when she came. A single gene in her bone marrow meant that she couldn't produce any white cells. So white cells are there to fight infection. They're there to protect us from the viruses and the bacteria that are everywhere. But this little girl, because of that gene that was missing, she had no white cells. And so just after a few months of life, she started to get coughs and colds that just didn't go away. She became incredibly unwell and went to a hospital. She was living in Poland at the time, and she went to the hospital in Poland, who looked after her and found that she had this very severe immune deficiency. They couldn't look after her because, as I said, the specialist expertise resides only in a few centres. Her father was English, and he rang Great Ormond Street, and he said, could he bring his daughter, Nina, to Great Ormond Street, where we looked after her. The only treatment for her was to have a bone marrow transplant. That is to give bone marrow cells from another individual to try and rebuild her immune system, to rebuild her white cells. But that treatment in itself meant that she had a 30% chance of dying as a result of the therapy. And the father said, I didn't want to take that risk with my daughter. So he asked me whether he could enroll his daughter into a new treatment, this gene therapy that we wanted to do. And this is how that gene therapy works. We don't use anybody else's cells. We wanted to use our own cells. So we take out her bone marrow cells. We introduce into her bone marrow cells a working copy of the gene that was missing or defective in her. Now those cells have the right gene, they have the right information, they have the right signals to now regrow white cells and build a new immune system and protect her from infection. So she stayed with us for a few months while we undertook the procedure. This was back in May 2013, and this is her today. So she's now a healthy, normal 6-year-old child who is doing just normal things. That one treatment 6 years ago is all that we had to give her. Since that time, she's had no other treatments. She doesn't have to take any antibiotics. And she's cured of her illness. And father sends me pictures of her playing and skiing and wearing ballet costumes, etc., showing what a normal life that she leads. This is another story. This is a story of a boy called Lake. He has a condition. All of these conditions are very difficult to pronounce, but this one's called chronic granulomatous disease. And here the white cells develop, but they don't function. They don't kill bacteria properly. So what happens is these individuals get lots of infections. They get liver infections, they get lung infections, they get brain infections, and it's a miserable life because they're in and out of hospital the whole time. Let me just tell you about Lake. He was diagnosed at birth. He's had hospitalizations throughout his childhood because it doesn't prevent him from getting these severe infections. And when I first met him, when I was attending on the wards at Great Ormond Street, he was on intensive care because he had an infection that has spread from his blood to his lungs and to his brain. And this is a scan of his brain which shows that he actually had bled into his brain. He was so unwell that we had conversations about his mother as to whether we should continue or not. And we made the decision to continue, and thankfully he pulled through. Again, he was given the option of having a bone marrow transplant, and the physician said to him, "You've probably got a 30 to 40% chance of dying as a result of the transplant." And again, he didn't want to take that chance. So again, we talked to him about taking his cells, inserting a working copy of the gene into those cells, and giving it back to him. And again, after that one therapy, now 3 years ago, he, again, is just living a normal life. So he's not had to be back in hospital again. He's stopped all his antibiotics. He's gone back to college for the first time. He's gaining weight. So again, as a result of that one-off therapy, we're able to correct this disease for the lifetime of that individual. This is Layla, and her story made headlines all over the world. And she was a world first with this form of therapy. And her condition, just tell you about Layla, because her condition was so severe. She had a very severe acute leukemia, and she had failed every chemotherapy, she had failed every treatment, and literally there was nothing else available for her. And a colleague at Great Ormond Street and UCL had an idea, had been working on developing a new form of therapy, which we now know to be called CAR T therapies. And what he did here, he took her immune cells, a special form of cell called a T cell, which normally protects us from infection, but can also protect us sometimes from cancer. And using genetic engineering, he reprogrammed her T cells to be able to fight her leukemia. And so, by engineering these cells, he was able to give back these cells to her, and these cells, when they saw her leukemia, were able to kill the leukemia and get rid of those leukemic cells. And for the first time since she'd had the leukemia, she went back into remission. And we did it in a way that allowed these cells to survive for a certain period of time, get rid of the leukemia, and then she had a bone marrow transplant. And again, she's been in remission and free of disease since that time. This was a child whose disease was untreatable and who has been treated through using these new technologies of genetic and cell therapy. And this will change the world of medicine because it will allow us to treat these severe genetic disorders through these therapies. I'll come back again towards the end to tell you about what the ZCR will do in order to be able to bring these to life for these children. But for the moment, thank you for your attention.
Thank you, Professor Gasper. And we will hear now from Dr. Manju, who will speak to us about her work in movement disorders.
Thank you.
Dr. Manju.
I'd like to start by saying a very big thank you. It's an absolute true honour to speak at this Mejlis. My name is Manju Kurian. I'm a professor of neurogenetics and a consultant in movement disorder neurology at Great Ormond Street Hospital. And I'm just going to present to you my neurogenetic translational research program. And really, I need to start by saying that the entirety of my research, at the heart of my research, is really the families and my patients. And in fact, everything I do is driven by the questions that families ask me. It's what we call a bench-to-bedside or a campus-to-clinic approach for our patients. And the families are so clever, they ask the right questions and they drive our research program. They ask us things like, why has this happened to my child? What's the underlying cause? They ask us, how can this have happened to my child? What are the processes? And most importantly, for the family and myself, they say, what can you do to improve the quality of my child's life? So these are the key questions that drive my vocation in this area to try and improve the lives of children with very, very severe movement disorders that I will show you. So just to summarize my research goals, the aims are really addressing these issues that are very, very important to children who have a higher risk of morbidity and a higher risk of mortality in childhood and their families. I use state-of-the-art genetic technologies, whole genome sequencing, single-cell RNA sequencing to find the underlying basis of genetic disease. I also use really new models, state-of-the-art stem cell models that I'll talk about to try and understand disease mechanisms. And these allow me to find genes, they allow me to work out disease mechanisms, and most importantly, I can use all this information to try and develop better treatments for the children that we care for. So this is a very busy slide, and the purpose of it is just to show you that since 2007, when I started my PhD, I've been involved in either discovering the gene or understanding the condition for over 30 rare genetic neurological conditions. And there's a wide range you can see here. So collectively, these rare diseases are more common than we think. But for the purposes of today, I'm going to focus on the 3 diseases I've shown you in orange, and I'm going to talk about 3 children that they affect. So why does a genetic diagnosis have clinical impact? Well, when I talk to the families in clinic, the major things that they say, it gives them a sense of relief. Finally, they know what's caused the child's condition. It allows them to have accurate answers. So no longer are they wondering whether the child truly has cerebral palsy, because I can tell them it's not cerebral palsy due to birth injury, it's due to a genetic condition. And families tell me that they have a sense of closure, that they have an answer. It also means that they don't have to have any more invasive, painful investigations, such as muscle biopsies or skin biopsies. It also allows us as clinicians to tell families what the future will hold, what we call disease prognostication. It allows us to genetically counsel families for future pregnancies. And most importantly, it allows us to think about the specific defect and then allow us to treat that through a personalized medicine or precision medicine approach. So when I started at Great Ormond Street in 2011, I was referred a number of different children. And at the beginning, I thought they all had different conditions. They were referred with what we call ascending dystonia. Dystonia is a condition that causes involuntary movements and postures, twisting postures. We were referred children who had twisting postures of the trunk and the arms and the head. We were referred children who were thought to have too much iron in their brains. We were referred children who had jerky movements with their twisting postures. And we were referred children that had low levels of the very important chemical serotonin in their brains. And all the clinicians referring these children to us did not have an answer for their children. And when we looked at this group of children, what we realized is that actually there was a very common thread throughout all these children. They all had twisting postures, and they all had severe speech abnormalities. Often they would whisper to us and speak with a very slurred voice. And in all these children, with our genetic techniques, we found one single gene called KMT2B. And I'm going to tell you the story of KMT2B dystonia with Katie, who's one of my very special patients. Katie presented to me being referred from her local hospital with a diagnosis of possible cerebral palsy. But Mum was convinced this was not cerebral palsy. She had no birth injury. She had a normal brain scan. And the actual absolute key to her answer was that over time she progressed. The first video at 8 years shows that she could walk. When I saw her again over the years, by 10, you can see she can barely walk unsupported. She has this stiffness in her lower limbs, you can see, these postures of her upper arms, and she can just about walk alone, but it's very, very difficult. And she was progressing over time from a child that was previously walking to, at the age of 12, as you can see here, a child who could barely hold her head up and could not walk alone. She needed her mum to support her all the time. And we found a change in the gene KMT2B in Katie and another 30 young people with dystonia. And we were able to tell Mum the answer. And for Katie, she had a little bit of her chromosome 19 missing, which included this important gene. And why is this important? Well, there is a life-changing treatment. So this is one of our children with KMT2B dystonia. And you can see here how he's very, very postured, he's twisted, he can't walk straight. He can barely walk at all alone. And when he had this procedure called deep brain stimulation, within 2 weeks his walking was fully restored. He does not have postures anymore, and his motor function has come back to normal. So this involved insertion of a special device, which then allowed electrical stimulation of his brain. And I know of worldwide stories now of children with this form of dystonia that have had this curative treatment where children are able to walk and their dystonia is markedly improved by this deep brain stimulation therapy. And Katie, back to Katie, our patient, she has just had this deep brain stimulation quite recently, and it's already had effect. She's less stiff and her walking has improved. But I think this slide summarizes it all. This is Katie with her mum, and her mum saying to learn that we weren't alone, to learn that there was other people going through very, very similar things. The diagnosis and then the treatment was an alleluia moment. So it really has transformed Katie's life. And this, at the time of publication, when we published this new gene, it was really picked up by many of the national and international press agencies with these amazing headlines. Genetic breakthrough allows treatment of devastating disorder in children. Gene discovery helps children with muscle disorder walk again. And my favorite really is the picture of one of our patients. You can see they're featured in the Telegraph. And she's standing, this was published at Christmas time, and she's standing behind her Christmas tree for the first time tall and straight, which she could not do before her surgery. So this is life-transforming treatment that these children are getting. However, not all the children we look after have such a miraculous story, and I'm going to tell you Shannon's story. This is a beautiful girl that I had the pleasure of meeting during my PhD, and she has an infantile form of Parkinsonism. You can see here, she's incredibly bright and she has very good understanding, but she can't move. She's just like an adult patient with Parkinsonism. So you can see here she has reduced facial expression. She finds it very difficult to spontaneously move. Here she's been asked to lift her leg, and she knows exactly what she needs to do. It just takes her time to do it. And during my PhD, I found the gene that causes her problem, and the gene encodes a protein that's very important at controlling dopamine levels in our brain. And when this gene is not working properly, it means that the dopamine can't get to the right place, which means that it results in having a lack of dopamine and this Parkinsonism condition that she has. Now, unlike KMT2B dystonia that I showed you before, there are no really good treatments. Children do not respond to drugs and they progress. It's a life-limiting condition, and the average age of death is 9.1 years. So there are no treatments, which really fuels our research. And with that in mind, we thought we'd better try a more novel way of approaching this condition. So what we've done is we've taken skin cells from our patients, and we've used a state-of-the-art technology and made them and reprogrammed them into stem cells, which have the ability to become any cells in the body. We've then made them into brain cells, and a special type of brain cell in the brain that controls movement. And we've used this fantastic laboratory model to look at the disease, to try and understand disease mechanisms, to screen for drugs, and to look for new gene therapy treatments in our dish. And we found that this model is fantastic. So this is the cell model of disease. And just to orientate you, the green is showing the beautiful neurons that we're growing. So you can see these hair-like projections, which are our brain cells, communicating with each other like threads of hair. And then the red staining is the special motor neurons that control our movement. And what you can see very clearly is when you look at the control, which is another normal patient, a non-patient line, and the CRISPR is where we've corrected the mutation or the genetic fault. We can see that there's lots and lots of brain cells, lots of green and red, but in our patients we don't see anywhere near as much. And this shows that the patients are losing brain cells. There is what we call neurodegeneration. So this is a really good model. We're showing in the dish what happens in human brains. And not only that, using this model, we were able to find out disease mechanisms. So what we found is that the children that we look after with this infantile form of Parkinsonism have inflammation in their brain. And it's the combination of inflammation with dopamine being very toxic that results in cell damage, and then this programming that happens that causes the cell to die. So we've used this model in a dish of brain cells from our patient's skin to be able to understand disease. And finally, and most importantly, we've used the stem cell model to develop new treatments. So we've created a gene therapy vector, and that allows us to put the healthy gene back onto the cells. And when we do that, we completely rescue the cells that are deficient, the patient cells, and there is no neurodegeneration. You can see here the red staining on the bottom line is clear indication that there is no neuronal loss when we treat with gene therapy. So this is really promising, and this work, together with other laboratory models in our laboratory at Great Ormond Street, has meant that we can now apply for funding to be able to do the gene therapy in our patients. And we plan to do neurosurgery to target the specific area of the brain to allow that gene therapy to hopefully make these children better. So then I'm going to finish really by talking about this little patient, Hareb, who comes from Dubai, who I look after. Because the question really is gene therapy a reality for children with neurological disorders? Well, I think Hareb's story tells it all. So Hareb came to me. He presented in infancy with these very painful ocular gyrate crises. His eyes deviate upwards. He arches. He's very, very stiff. And the family noticed that he had low tone, so unlike their other children, he did not control his head at the right time, he did not sit at the right time, and they knew something was wrong with this little baby. And through genetic testing done in the UAE, he was diagnosed with this condition called aromatic L-amino acid decarboxylase deficiency. It's a very long name, and all it means is that the body does not have enough of the chemicals, dopamine and serotonin, that help us control movement. He came to me and we gave him treatment. And even after the limited treatment we have right now for this condition, which is a combination of drug treatments and also intensive physiotherapy, you can see that he's done very well. He's able to sit with splints and he really has improved. But there is a new treatment that he will come for. We're just organizing the processes of that, which is gene therapy. And in due course, the hope is that Hareb will have gene therapy into his brain to replace his faulty gene. So I hope I've shown that the landscape is changing for neurological conditions of childhood, that actually no more can we say that these are untreatable conditions, that we can find the gene, we can understand the disease processes and move towards novel treatments for these previously untreatable conditions. Thank you.
Thank you, Dr. Manju. Before we begin our Q&A session, Professor Gasper, can you tell us more about the Zayed Center for Research in Rare Disease in Children?
So you've been able, from what Manju said and from what I've said, you've seen that we've been able to do a lot. But of course, there's so much more to do. So many more diseases, so many more children. And so that is what the Zayed Center for Research will do. It's going to open in July 2019. We have an opening ceremony on July the 2nd. And what we want to be able to do is to advance in many different areas, to try and find the underlying cause of the disease through genetic research. And that is one of the major parts of the center. We'll have state-of-the-art gene and stem cell facilities so that we can actually grow those stem cells, where we can introduce genes into those cells to do the research that allows us to do that. We'll bring together internationally renowned researchers so we can collaborate, exchange ideas to develop these therapies. And the whole aim is to try and accelerate these new therapies for children. The ability to do that, the inventions that go with that, will also generate novel intellectual property, know-how that can then be licensed to commercial entities to take forward to make these into new medicines. And that in itself is incredibly important, because that partnership between academia and commercial entities will actually lead to new medicines that can be used by children globally. It also generates intellectual property and know-how that can in itself be sustaining, so it brings back revenue to the hospital so that this can be sustained over a long period of time. Here is the donor wall that acknowledges this extraordinary gift that has been given to the hospital and the university by yourselves. And this is a beautiful piece of art that sits at the front of the building. As you walk into the building, everyone will see it, both the children who are going to the outpatients and the researchers and the scientists that will be going to the laboratories. It sits right at the front of the building, and people, as they walk along the street, will be able to see that as well. It is not only beautiful, those lights look incredibly beautiful, but they're actually what we call a microchip array. It's a genetic assay that is used to diagnose children. It's just one of the tools that we use to be able to diagnose complex diseases. And this comes from a child who is born with a congenital form of deafness. And so it's actually the microarray from this individual. So not only does it look beautiful, but it also has a very important purpose. It also is a world first. It is a world first, a purpose-built facility that is looking at developing new therapies for children with these rare diseases. The laboratory here is a laboratory of over 100 that can accommodate over 140 researchers and scientists from different disciplines that come together to be able to collaborate and to exchange ideas. The laboratory is double height, it's an extraordinary space. It looks out onto the street, and people walking along the street can then look down into the laboratory so that they can see research at work. And I think this is a symbol of what this centre is about and what it can do, and is open to the public, so it engages them in the work of the Zayed Centre. And finally, what we're building is a STEM and gene therapy facility. So these are the rooms where the children's cells go, where we introduce a working copy into those cells, and it has to be done in a very special environment. The air must be clean, everything must be clean. We make sure that the air is filtered appropriately to stop any contamination of these precious cells. And what we're building is 7, at the moment, what we're doing is we have 2 clean rooms in Great Ormond Street Hospital to be able to do this kind of work. We've had to turn away some clinical trials because we just haven't got enough space or capacity to do that. We're going to go from 2 to 7 clean rooms and a simulator room as well, which will allow us to perform far more therapies. It will be a huge expansion in our capability. It will also act as an infrastructure and a facility that can collaborate with other researchers in other institutions so they can do their gene and cell therapies at this Great Ormond Street facility. So it helps not only the researchers, scientists, and patients at Great Ormond Street, but those elsewhere as well. And it will be one of the largest, if not the largest, facility of its type in Europe. And so I just want to take a moment to say this is an extraordinarily exciting venture. It has come about because of this generous and extraordinary gift from Sheikh Fatima, and we're deeply grateful for that. We hope that this gift will build a really special facility and centre that will change the lives of children, not just at Great Ormond Street, but worldwide through innovative gene therapies and cellular therapies and new treatments. And in changing these lives, we will also be changing medicine for these complex disorders. Thank you very much.
Thank you both so much for your tremendous insight and perspective in the rapidly advancing practice of children's medicine. I would like to now invite questions from the gathered guests, but I would like to start with a few questions of my own. So, Professor Gasper, gene therapy is not new, and yet most patients who suffer from various diseases, as you mentioned, continue to be treated with either drugs or surgery. How soon will the drugs and surgery treatment options become the minority and the gene therapy options become the majority?
Yes, and thank you for your question. It's very insightful. The research in gene therapy, as you say, has been happening for many, many years now. I started 25 years ago with looking after the very first patient in the UK that underwent gene therapy. But there's a lot more publicity and noise about it now. But that's because any form of therapy has to go through many iterations before it becomes safe and effective, especially for use in children. So the first trials, although they showed some promise, also had some side effects, and we lived through those. We had to go back and think about how we improve these therapies, how we make them safe for children, how we make them more effective. And so we're now at another phase of developing these. And now there are many examples of how gene therapy, the kind of gene therapy that I talked about, has actually dramatically changed the lives of children. But that is in the academic setting. It now has to go from academia through regulations and the scrutiny that regulators need in order to make them into approved medicines. And in fact, now we have the first approved gene therapy medicines that are now available for children in the USA, in Europe, and will come to other parts of the world as well. But that is just the start. So there are now, I think, 4 approved gene therapy medicines, and there will be many more to come. And so we will start to see this as becoming a mainstream medicine for a number of different disorders. And so the kind of work that Manju has talked about, it's really just at its infancy, and it will take some time in order to get these to be used on a more global basis. But I hope that the learnings that we've had will be able to accelerate that timeline, and that is the kind of work we'll be doing in the Zayed Center. We'll take those learnings, take that experience to be able to move things more quickly so that more children can benefit in the future.
That's fantastic news, and it's something that I know we're looking to hopefully be able to support you in introducing it here in the UAE as well. Professor Kurian, a question for you if you don't mind. Deep brain stimulation has proven highly effective in the treatment of those suffering from Parkinson's disease, as we saw in the patients in the stories ahead. Do you envision gene therapy replacing or complementing deep brain stimulation?
Again, I think that's a fantastic question, very insightful indeed. In my experience as a movement disorder specialist, deep brain stimulation really only works to that extent for 2 conditions. One's this form of KMT2B dystonia, the other's called DYT1 dystonia. And apart from that, to me, none of the others have the miraculous response that a treatment should be aiming for. Sometimes deep brain stimulation is used as palliation, so children with very, very severe movement disorders that are very, very painful, it's used as a kind of measure to help children cope with the painfulness of their symptoms. I'm not sure it's ever going to be a cure for the majority of conditions, and those conditions we should be working towards precision treatment, so understanding why this condition has happened, what are the pathways involved, and targeting our drugs, gene therapy, compounds, chaperones, RNA therapies, all these new things towards those deficits that happen from that genetic defect.
Well, thank you. And I think you mentioned this earlier, and it's something that we face not only in the UAE but all over the world when it comes to the introduction of gene therapy treatment, is that it is new, that the regulation is still nascent. It's something that we are still working on to understand how to regulate it so that it could be safe for our patients. Is there any, a question for both of you, any ethical considerations that we should be thinking about as we think to treat patients or loved ones of ours?
It's, again, a really important question. It's a question that really kind of pertains to any kind of novel therapy, not just gene therapy, but others as well. And as you develop these new therapies, and you have to go through a very rigorous development, that is testing of these new treatments, both in the laboratory, some of the kind of work that Manju showed in relevant animal models, to look at both the safety and the efficacy. And then you have to go through the regulators to ensure that what you're doing is ethically sound and is also has been put together in an appropriate fashion. And then you undertake a very rigorous clinical trial. Now, whatever you may have learned beforehand may not always be what you see when you start treating patients, and that's why you have to do it in a very controlled circumstance. And we've lived through some very severe side effects when we first started with gene therapy, and we went back to the ethical bodies and said, look, it has shown some efficacy, we think there is promise there, but clearly there are some other problems. And we worked with them to develop the next generation of treatments, which are now showing a lot of efficacy and safety over a long period of time. So I think it is important, but as long as scientists and clinicians show responsibility, transparency with their patients, work together with the regulatory bodies, then I think patients and families can have reassurance that what has been developed is safe, for, as you say, for their loved ones.
Same question for you.
Yes, I mean, I think Bobby's really summarised it beautifully. I think when we mention to families we're working on gene therapy, many of these conditions that we look after are life-limiting, and families want treatment straight away. The AADC, the last story I showed with Hareb, where hopefully in time he'll go for gene therapy. That's taken a good 10, 15 years of experimental kind of rigor from laboratory models all the way to human trials. So these things take time, and I think the important ethical question to make sure we address is that we do everything with scientific rigor, and if it's done that way, then we'll be able to deliver as safely and efficaciously as we can to families and patients.
If I may just share some experience with you, when we looked after some of the children that I talked about. When we talk to families, we always talk to them about what the options are. So in the children that I look after with these very severe immune deficiencies, there is no option to do nothing, because if we did nothing, their child would die. We then say, look, there is an option to do a bone marrow transplant, which it can be a very good therapy, but unfortunately there is a 10 to 20 or maybe 30% chance of losing your child in the next 6 months as a result of the transplant complications. But if they get through it, then everything will be fine. But that is the standard therapy. So there is that risk in that short-term period. Or you can have this experimental therapy that we have tested in the ways that Manju's talked about. And because it's the child's own cells, we can almost guarantee that your child will survive the procedure. And we think there is a good chance that it will work. In every occasion where we've talked to the families, they've always wanted to go for the gene therapy, because for the families, the most important thing is their child is still alive. Because even if it doesn't work, they can fight another day. And so, you have to think about the risks and benefits of all of these therapies.
Well, thank you. It's very insightful, and it's definitely something to think about, especially for the loved ones that have been affected. I think with that question, we'd like to also be able to thank both of our guests for their comments. And in conclusion, I'd like to also أستأذنك سيدي لاختتام المحاضرة. On behalf of the guests gathered here this evening and the people of Abuظbى, I would like to thank you for the phenomenal work that you do every day. The practice of children's medicine is both challenging and rewarding, and you two approach it with such great passion and enthusiasm, as seen in your work, and also the effect on your patients that we saw today. We wish you every success in your continued work, and best of luck in the opening of the Zaid Center for Research into Rare Disease and Medicine. Thank you so much for joining us here this evening with your insightful and moving remarks. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.